Welcome, everyone. On behalf of the Centers for Medicare and Medicaid Services, Division of Tribal Affairs, I would like to welcome everyone to an All Tribes webinar. My name is Nicole Pino, and I work for Kaufman and Associates. I'll be your moderator today. Today's webinar is titled Best Practices and Lessons Learned on Improving Health Coverage in Tribal Communities. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. At this time, I will turn it over to Beverly Lofton.
Thank you, Nicole. I'm Beverly Lofton. I'm a Senior Policy Advisor in the Division of Tribal Affairs at CMS, and welcome to today's webinar. This webinar is in collaboration with the CMS Division of Tribal Affairs and the National Indian Health Board, NIHB. During this webinar, NIHB will highlight the importance of outreach and education as it pertains to health coverage options and share best practices to improve enrollment in tribal communities. This webinar will provide an overview of how lessons learned can help gain insights and knowledge to measure the success of outreach and education. Any materials related to this presentation can be downloaded from the Spotlight page of the CMS American Indian and Alaska Native Outreach and Education website. And that website can be found at go.cms.gov/AIAN. The web link will be added to the chat of this webinar. So we are pleased to be joined on this webinar by Christian Bitsui from NIHB. So I will now turn it over to Christian to begin her webinar.
Oh my goodness. Thank you so much, Beverly. It is so good to be with you guys. As Beverly mentioned, that my name is Kristen Bitsui. Good morning to those of you that are still on the morning side, and good afternoon to the rest of those of us that are enjoying the afternoon right now. So I'm very honored to be able to be on this platform, which is the CMS platform, to share with you guys some of the best practices and lessons learned. So I'm hoping that this webinar will be able to help you understand how lessons learned can help with gaining insights and knowledge to measure the success of outreach and education. So we all know that when assisting tribal citizens with healthcare coverage enrollment was very challenging throughout the public health emergency, and it still remains challenging during the Medicaid unwinding process as well too. So let's get started here. So at NIHB, I wanted to share this mission statement with you to kind of understand the role that I have at National Indian Health Board and the things that I do to be able to raise a lot of awareness and also elevate that visibility of Indian healthcare issues to the national platform. And, the NIHB's work is so crucial to a lot of Indian country. And NIHB plays a role where we focus on the national attention on Indian healthcare needs and developing maybe tribal health policy recommendations. We're advocating for tribal priorities as well too. So, I wanted to share this with you to sort of understand what I do when I'm in your community and I'm asking questions or you're wanting to understand what some of those challenges are that you are encountering as you're doing health insurance coverage enrollment. And then, with that research, I'm able to take that back and talk to our policy team to let them know what's happening in the tribal communities as well too. So let's just go right into it. So we know that there's a lot of challenges that happen within our tribal communities, right? I mean, we found out that mail delivery to PO boxes can be something that's extremely challenging, especially in the rural side. And you're thinking about also those that are probably even further than the rural, or maybe they're isolated as well too. I mean, that happens a lot in Alaska. So through these challenges, we're trying to figure out, what do we need to do to make sure that our tribal citizens are enrolled. We want to make sure that they have some sort of coverage, whether if it's Medicaid, CHIP, Medicare, health insurance marketplace. We're looking at these challenges and finding different ways to go out to them and to be able to come to us and complete these applications as well too. Some of the things that we have heard is that the applications can be so complex and it could be complicated in a way that they might not understand maybe the terminology on there. Or maybe it's an online application and they might not be used to being on the computer as well too. And so we're learning these kind of things so that we're able to assist our tribal citizens as well. We hear about lack of transportation. And through the pandemic, we have realized that, we were trying to figure out, why are they not bringing in their documents? What is going on that they're not coming to get assistance as well too. And a lot of it was due to transportation. Maybe they were saving their gas as well too. I mean, they still have to haul water. They still have to go to doctor's appointments. They still have to do other things, maybe get groceries and, save that gas money for that as well too. And going to the post office is probably sometimes a one-time a month thing that they do as well too. And so figuring out a lot of these challenges, and along the way, we also found out there was limited and maybe even no internet connection as well too. Our Medicaid agencies were also lacking staff to be able to work with individuals. And one of the main things through the pandemic that we found was that, when the clinics closed down, the hospitals closed down, the doors were not open to just anybody coming in. And having that face-to-face is something that our tribal citizens are so used to. They like to be able to go into the office and get that assistance done. So learning from that is that, there are different ways that we can still be able to assist. And so those are just some of the challenges and ways that we want to make sure we have effective tribal community outreach and education as well. So when we talk about challenges, then we're thinking about lessons learned. Lessons learned are a valuable process of obtaining knowledge through experience, like performing tasks or going out into the community or creating brochures. And when you actually put it in front of someone, they might notice something, or maybe they're sharing something with you and you're figuring out, oh, you know what, maybe if I add this as well too. Oh, I missed this. Or maybe when you're in the community and then you are in front of a group of individuals that you are maybe educating as well too. And then they tell you something that makes you think, oh, okay, well, you know what, next time I'll do this, or maybe I just need to tweak this a little bit. So a lot of that lessons learned were figuring out of what we need to do. The first one is tribal enrollment assisters understand the unique enrollment requirements and application process for our tribal citizens. Our enrollment assisters that work directly with our tribal citizens, those of you that work in the facility, the IHS, the tribal site, even the urban organizations, you sit there and you understand a lot of that information that they need to be aware of, such as their protections, such as their provisions, understanding that if they need to submit their tribal documentation in order for them not to have to pay anything out of pocket as well too. So those are some of the things that we have also learned, that this group of those of us that are the tribal under the tribal enrollment assisters. When I talk about tribal enrollment assisters, I'm talking about patient benefit coordinators. I'm talking about the assisters that are at the tribal site. I'm talking about the urbans as well too. We each have different titles for being able to assist. But I wanted to make sure that you understand that we know and we understand that you do know those kind of things. So that's the reason why it's easy for you to explain to them about their documentations. It's good to also tell them about their Indian income. And we understand that, and we've learned from that as well too. And then as well as being able to partner up with other organizations or even other enrollment assisters. We have the Navigator Cooperative Agreement as well too, that is out there. And there are some organizations that have indicated that they would be able to work with American Indians, Alaska Natives, Native Americans, tribal communities. There's different terminologies they might have used within their target population that they said they're going to work with. So that's another grantees that you might be able to reach out to as well too, and taking a look at some of those organizations. Another one is connecting kids to coverage, Healthy Kids, American Indian, and Alaska Native. I believe there are 7 of them that got this grant as well too. There's one in Montana, I believe it's All Nations Health Center. Oklahoma is also another one. Choctaw Nation of Oklahoma, Chickasaw Nation is another one. Minnesota Indian Health Board of Minneapolis, I think that's what they're called. Alaska got one as well too. South Central Foundation, Nevada was another one as well too. And Colorado was another one. So, reaching out to some of those organizations and seeing if they also need to meet deliverables within their grants, right? They want to go out to facilities. You can always partner up with them so that they can come in and assist you as well too. Because what we've found out is that a lot of times when our tribal citizens do go to the Medicaid office, right? And sometimes the caseworkers might not be too knowledgeable about some of those special protections and provisions that are specifically for our tribal citizens. And that's just probably because they don't see them on a daily basis. Whereas those that are tribal enrollment assisters, you know those things because on a daily basis, that's all you do. And also, being able to customize a lot of the outreach materials that are specifically to tribal communities. We communicate so differently within our communities that it's important that we customize them as well too. And a lot of the stuff that I've heard was, okay, so, if we put different, even pictures, if it pertains to that area, and maybe they put it on a flyer, all of a sudden the individual within that community will think, oh, hey, they want to look at it and see what that's all about as well too. But they notice that the picture first, and they notice that, oh, that's familiar to me. So let me see what's on there. And so a lot of times we're customizing those materials, and that's extremely important when it comes to outreach and education for our tribal communities. Social media is something that we've learned through the pandemic that has been a useful tool for all of our tribal communities, another way to be able to do outreach and education, to give them information that they need to be aware of so that they can understand what's going on. And it's also another way that you don't have to be in front of them. You don't have to go out into the community. And it's something that they're able to look on, whether if it's Facebook, whether if it's social or Instagram, whether if it's X, formerly known as Twitter, those different platforms as well too. And that could even mean that other individuals are also looking at their emails too. So those are other useful tools that we have learned, and some communities have decided that worked. So I'm going to still use that and still give out information through social media as well too. Another thing is being able to share some of those experiences of tribal citizens within your community. When you are coming across an individual that may be either hesitant or maybe really doesn't understand, because it's just so complex that they think, well, maybe, why should I even apply for health insurance? But if you know of other individuals that you may have helped, and you explain to them what those experiences were for them, and maybe they can sort of gravitate to that and understand, oh, okay, so that happened to someone within my own community. So, they want to make sure, they want to hear those kind of things as well too. We've learned that being able to share those experiences as well too is very helpful. Understanding the community's culture, the history and traditions is extremely important for our tribal citizens. They want to make sure that you understand that you're working with their community and that you know who they are. And that's one of the reasons why I always say that our tribal communities are so unique when it comes to outreach and education. It's not the same as for the general population, and you have to know who you're working with. And if you can speak their language, they're always wanting that as well too. And we learned that that's very important when it comes to doing outreach and education. And I spoke about communication as well too. The way we communicate within our tribal communities is so much different. Word of mouth is probably something we've always learned that it works. They listen to their tribal radio. They listen to different things that are within their community, where they get that communication at, whether if it's maybe a poster that was created, whether if it's just a bulletin board where you post things as well too, those communication as well too. Elders is probably one of those things that we always say that if you let an elder know, majority of the time they will share that with the rest of the family or even with their community as well too. When it comes to tribal communities, we don't acknowledge one another as, a friend or maybe a cousin, or, it's always a brother or a sister or your aunt, your uncle. We acknowledge each other that way as well too. And so when we talk about things and we're teaching things, that we always make sure that we understand how that communication is for each of the communities. So let's get into some of the best practices. So we know that within the tribal communities, the way outreach and engagement happens is that, the connection, we collaborate within each other within our communities. Those relationships that you create are extremely unique, and understanding that that's also an effective engagement as well too. You want to be consistent. You also want to make sure that you know the community. If you know that, okay, there's going to be this engagement going on, maybe they have little gatherings that they go to, and that certain groups are going to be there, whether maybe if it's the elders, or maybe it's going to be the kids, or maybe it's going to be young adults as well too. And so, just being able to be respectful as well too, when you're being consistent and being able to share that information that needs to be shared as well too. Tribal leaders is another way to be able to educate them. And we've realized that these are some of the best practices that have come out from doing outreach and education. And when ACA first came into law, and we started the enrollment through there and figuring out some of these ways of being able to continue these best practices, I always love to hear what's going on in the community. I want to know what you've done. I also want to know things of, how did you do it? What did you create? And what did you get out of? Because I also want to share that if it's somewhere on the the northern tribes, I want to take that over to maybe to California and share that with them. And being able to share those kind of things, they might be able to tweak it somehow to work for their community or to make them think of other ways to continue to do their outreach and education as well too. And we also listen, we learn from either going into the community, creating maybe outreach materials, or just educating, or maybe you're just sitting there, assisting as well too, going through the process of the application. You want to talk to them. You want to learn what's going on, maybe why they did not renew their application, because learning from those can also create best practices as well too. And you want to make sure that you understand those things. And along the way, as you're doing that and engaging into a dialogue to understand their perspective on, and even their needs as well too, of why they did not apply for a health insurance coverage earlier, why they did not renew, and what brought them into your office. Those needs, you want to understand that as well. When you go through all that process, you're building that trust with them as well too. Tribal communities, our trust is based on that. That's the fundamental pretty much within all tribal communities. You want to demonstrate transparency. You want to demonstrate consistency. Integrity comes with all of that as well too. And so we want to make sure that that engagement is going. When you look at this list on this slide, you're looking at enrollment data as best practices. You want to see what's going on in your community. If you have a report that you can pull together and look to see who's uninsured, whether if it's the kids under 5 or maybe school-age kids, maybe young adults that are college students, elders, and even just adults. You want to get those parents, you want to get those that are maybe don't have kids as well too. And so you're looking at data for you to determine which groups that you want to also do outreach to as well. You also want to look at that data to determine, maybe the month, there's something going on. So it's February, so it's Heart Month. You want to look at that as well too. You want to put outreach materials out there. And so, and as I, talked a little bit about navigating social media, partnering up community organizations. I just talked about the outreach grantees as well too. And being able to do one other thing that through the pandemic, and I think we started this before the pandemic as well too, internally training inside your facility, in-reach is what they call it, staff that are maybe from other departments, for instance, public health nurses, those that work directly with the patients as well. And some even educated their HR staff, their facilities as well too, housekeeping. Because a lot of times what happens is that a lot of our tribal citizens, they think, oh, you know what, that person works at IHS. They probably know what's going on and what this, maybe they see something on their social media and they will ask them questions. And so it's good to make sure that they're aware of who you are, who the patient benefit coordinators are, where they can go. If there's a community event that you're going to be at, it's good for them to be aware of those kind of things as well too. The other thing was placing tribal enrollment assisters at different departments, like dental. You wanted to catch those that were going to dental. You want to catch those that go to pharmacy as well too. We do have facilities where tribal citizens go directly to go get their medication and they go to pharmacy. So they don't check into their patient registration. We do have some facilities that whether you're going to get meds, whether you're going to go to lab, but no matter where you're going to go to, you still have to check in with the patient registration. And then that's where they catch them at. But being able to place them in areas where they can pick them up and be able to let them know, oh, you have, either your insurance has a gap, you didn't renew, you better go see, to make sure that you're going to get coverage again. As well as I think one other big one that came about was behavioral health. Through the pandemic, we've realized that a lot of our tribal citizens have been going through behavioral health as well too, and placing some of those assisters there so that they can catch those that are uninsured. Data sharing from the state Medicaid. This is something that we've learned that some states have done this as well too, and it's created best practices for our facility. They can get this list of individuals that are going to be falling off of Medicaid within the next 3 months or so, depending on your state Medicaid, how they share that, and how in advance that they can provide that list as well too. And being able to be visible. I think that's one of the big things we have learned through the pandemic, is that you want to be visible. You want to let them know where you're going to be. You want to let them know how you're going to assist them, whether if it's, can you do it on the phone? Are you able to walk them through the online? Do you take appointments? Are you going to be somewhere in the community on the weekends and the evenings? Those kind of things that they want to be aware of. They want to also know you have groups that we have learned through the pandemic that may have not had Medicaid for the longest time, but they lost their job. And then all of a sudden they got on Medicaid during the pandemic. And that's the group that might not be aware that every year they're supposed to renew their application. Being able to inform them and let them know some of that process that's happening, and knowing and letting them know too that you're available to help them in that way. Just being visible in the community, within your facility, and also to other organizations. You want to make sure that they're aware that you're the person that majority of your tribal citizens that live in that area or within the state, that you're able to help them as well too. A lot of times we hear from tribal citizens that, oh, I went to this organization and I thought they were going to help me, but they didn't really tell me about all these other things that I was supposed to do, or why do I have to even turn in Indian income, things like that. So being able to share that knowledge with other organizations that may see some of our tribal citizens and assist them as well too. And one of the biggest and the most of all of our best practices is probably our elders. They're our greatest teachers and they are the best messengers. And word of mouth coming from an elder is probably huge for us. And being able to share that with them too, and let them know. And a lot of our tribal communities, a lot of our elders are also taking care of their grandkids. And so making sure that the grandkids have some sort of health insurance coverage as well, and informing them of what needs to happen, what they need to turn in, why it's important that they bring their documentations with them. And I'm hoping that we're going to find some way by talking to each other, learning from one another, of how we can get a lot of our tribal citizens to be able to turn in their documents. And as I mentioned, that's one of the biggest challenges that we have within our community, is that, what are some of those things that we can do to be able to make sure that our tribal citizens don't have any gap in coverage when it comes to Medicaid. We're at the end of our Medicaid unwinding as well too. But these are just some of the things that I wanted to share with you when it comes to best practices. So next slide. So here we have examples of some of the outreach and education efforts that we have seen that has been shared with me as well too. Whether if it's a paper form, an electronic, or something visual that we create, and then also some of those personal contacts. And some of them are, things that we've always heard since we've been doing outreach and education. And we know that outreach and education works for our tribal communities. And being able to get a lot of these materials out there and teaching and being able to explain to them the reason why they need to apply as well too. And you don't have to be there. So if you have a fact sheet or brochures that you can put in the waiting room or leave at the senior citizen offices, or being able to take them to the schools, or maybe even giving them to some of the CHRs in our community. We also have WIC that are there that we can give those things or any kind of paper form to them as well too, so they have something to give out. They might not read it right then and there, and they take it home, they put it on the fridge, they put it on the counter. Some other family member comes in, they take a look at it. And so those are some ways to be able to do that education without being there. Electronic social media, as I talked about, has been pretty huge. And I think that's something that's going to become a best practice, or it is a best practice, and it will continue and grow with it as well too, and learn how to use it, learn how to be able to educate on it, share information on it as well too, like open enrollments for different coverages, Medicare. We have Medicare Advantage open enrollment that is ending pretty soon here. Just informing them that if they mistakenly got on an Advantage plan, this is the time to go back to the original Medicare, or maybe they didn't get on a drug plan. This is the time to do that. And you can do that through social media. There are websites. We have hospitals, clinics, the urban side have web pages that they can put that kind of information on there as well too. Emails, public service announcement on tribal radios. We have Good Health TV as well too, that you can put information on there, and while they're sitting in the waiting room, they're listening to those kind of things as well too. Bulletin boards are pretty huge in a lot of the rural area, where they are able to either staple something on there, thumbtacks, things like that. A new one is also texting through the pandemic, trying to inform them of maybe they need to come in and renew their application, or letting them know that you have no health insurance, you're going to be referred out, we need to see you, that kind of thing. There's some of our facilities that are able to do that as well. We have the visuals, signage, posters, banners were also created during the time of the pandemic, whereas not the whole family couldn't go inside the facility. So you either had the driver or the family had to stay outside in the vehicle. And there's an area where we had enrollment assistants that actually made these posters to let them know. They put their phone number on there, how to get a hold of them, and what they do. And so that individuals were able to sit there and look at those banners as well. Presentations to tribal leaders, the tribal government, to different organizations, to anybody in the community. There are youth organizations. We have our senior citizen centers. We have our schools, our Head Starts, those places where you'll be able to do those presentations as well. And since we're doing a lot of face-to-face outreach, now we are able to put up booths as well too. And then those personal contacts, as you're doing all of this work, you also want to make sure that you are being able to get their contact information. they might be able to partner up with you and get together and help one another when you're doing your outreach and education as well too. And so it's always good to understand who your target audience as well too. There might be some organization that also has that specific target audience that you're trying to reach as well too. And it's good to let them know. And so these are some of the examples that were shared with me. And then I want to get into some of our enrollment data that we have seen. So as I've gone through the challenges, the lessons learned, the best practices, we want to see, where we can target these individuals and what are we looking at and what does that look like for us. When you look at data, you want to know like, oh, that year we did so well, but what do we do so good that we might be able to even do the next year, 3 years down the line, or maybe you want to look all the way back to, several years back. And when you look at this chart, this is for the marketplace, specifically for American Indian and Alaska Native. And it shows that the marketplace open enrollment from 2017 to 2023. So when you look at this in 2023, the race is unknown for almost 40% of the people who signed up for health insurance using open enrollment. So the lack of the race data is similar for other years as well. So while these numbers are likely not all of American Indian and Alaska Natives who have enrolled into the marketplace, it does show an upward trend. So the enrollment is going up, and we always want to see that, right? We want to see enrollment going up and up each year. And so when you look at from when the pandemic happened of 2020 to 2023, the enrollment jumped up so high and so fast. And, knowing that a lot of our tribal enrollment or our tribal citizens were trying to figure out, okay, I'm not eligible for Medicaid or CHIP, then, what is left for me? And so a lot of them were looking into the marketplace. But as you can see here, we went from 50,000 all the way to 66,000 between 2020 to 2023. And so, looking at this, it's amazing to understand that with outreach and education, how that also helps when, reviewing some of these data. So this chart shows uninsured rates for American Indian and Alaska Natives and the overall population. It's broken down by age group across the board, where we can see that American Indians and Alaska Natives are likely to be uninsured compared to the overall population. So with, let's see, American Indians and Alaska Native adult ages from 19 to 64 and children are the greatest risk of being uninsured. So when we're looking at this, we're thinking, okay, so, we see this age group and we want to make sure that we're also, is this within my state? We want to make sure we're looking at these things and making sure that, well, what does this look like in my state? I better run something either internally or look at, some of the other data that NIHB has as well too. So on this slide, you'll find some updated statistics around Medicaid unwinding. The most recent data available is from February 13th, 2024. So as of this date, nearly 17 million Medicaid enrollees have been disenrolled. So the disenrollment rate ranging from 13% to 59%, while procedural disenrollment rates range from 23% to 93%. And this data comes from the Kaiser Family Foundation, Medicaid's unwinding tracker. So that's how we sort of look at it. And we want to make sure that when you are doing your outreach and education, that these are some of the things that you're looking at as well too. And when you look at this, you're thinking, oh my gosh, is this my state? What does it look like for my state as well too? And we don't want this, to keep happening. And we want to make sure that we're doing this work and we're making sure that they understand the importance of doing that renewal versus doing a brand new application. And I always say that, the renewal could take up to 15, 30 minutes, right? Well, and if they end up falling off, that means that they have to redo the whole application. That could be about 2-3 hours on top of them traveling to the facility. On top of that, they might even have to wait several hours for you just to complete that application as well, too. So this slide shows 3 estimates that NIHB calculated of what might be the impact of unwinding in Minnesota. So I wanted to pull some data that kind of show different numbers as well too. So let's see here. So these numbers in the chart, they show possible numbers of American Indians and Alaskan Natives could be disenrolled from Medicaid due to unwinding. So this estimated range from 4,700 to nearly 8,000. So Minnesota is one of the few states that actually report Medicaid disenrollment numbers for American Indian and Alaskan Natives. So some of the other states include Oregon, Wisconsin. So then we're able to compare NIHB's estimated against the number of American Indians and Alaskan Natives disenrolled from Medicaid in Minnesota. So, we're looking at these things and we're understanding what the data looks like for our tribal communities. So this one is for Oregon, and NIHB's estimates of American Indian and Alaska Native disenrollment from Medicaid due to unwinding ranging from 3,900 to about 9,000. So comparing NIHB's estimated against the actual number of American Indians and Alaska Native disenroll from Medicaid in Oregon, which is 3,704, shows that this number is slightly lower than the estimated calculation that we did for method 3. So, just looking at all these things and how we're looking at what has happened with Medicaid unwinding. So now let's go to Wisconsin. So the estimation for American Indians and Alaska Natives disenrolled from Medicaid due to the unwinding range from 4,000 to nearly 8,000. So the actual number of American Indians and Alaska Native disenrolled from Medicaid in Wisconsin is 4,626. So this number falls within the range of what NIHB calculated as their estimate as well too. So, just looking at this, it makes you think and you sort of kind of understand what's going on in the state of Wisconsin. So finally, in this one, we're looking at all of Indian country, and the impact could have been somewhere between 380,000 to 520,000 American Indians and Alaska Natives. So according to NIHB's estimates using methods 1 and 2, we were unable to determine an estimate for method 3, since it relies on the state reported Medicaid enrollment numbers, which is not available for Indian country or United States. So therefore, of course, we are also unable to determine the actual number of American Indians and Alaska Native disenrolled from Medicaid across Indian country. So that's the end of the data part, to sort of kind of give you an idea of how things are happening with each state when it comes to Medicaid unwinding. The other thing I wanted to share was the NIHB storyboards. This is something that was in the making for quite a while. When we were doing the CMS ITU trainings, I gathered stories, and those of you and some of you probably remember how I used to provide you a forum for you to share with me some of these stories that have happened within your community. And so what we did is we put it in a way that we're able to use as being able to educate. And as I have spoken about how elders are usually the individual that have, be able to share the messaging that we're trying to do when we're talking about enrolling into any kind of health insurance coverage for our tribal citizens. So this is another form of way that we can do to be able to share that out as well too. If you have a phone or anything, there's the QR code that you can take a picture of, and you'll be able to get that right directly on your phone. The next one is NIHB was able to also do a podcast, and it was something that was extremely successful for us. So if you also take a picture of that QR code, you'll be able to get the first season of there's six podcast recordings that we did as well too. And you'll be able to listen to some of those. We are doing the second season of this. So it's in production, and it should be released sometimes in the middle of this year as well too. So it's something that we're looking forward to, and I wanted to share that out as well. And it's also, being able to utilize that to be able to educate our community as well too. And that is the end of my presentation. And I always like to share certain things at the end, whether if it's a quote or not. Since I'm a tribal citizen of the Navajo Nation, I always, use my language as well to share this out. And we speak a lot of our traditional language to be able to share the information that we are also doing in the work of health insurance coverage. And, sometimes the translation is a little bit different, but when an elder talks to you in their native language, it's so endearing, and it's telling you that, keep doing that work. It's needed. Yes, the work is hard, but we understand that, but it is just something that is needed and something that has to happen. So that's the reason why I always like to share something in that way, even though it says keep at it and work hard. It seems so straightforward, but in our language, it's more of being able to be saying good job. So that's the end of my presentation. So back to you, Beverly.
Great,
Thank you, Christian. So if you could stay on here, we'll check to see if there are any questions. I think we may see a question or so. And then also, Nicole, can you remind people how they can unmute to ask a question as well?
Of course. So yes, we'll be addressing the questions already submitted in the Q&A box located at the bottom of your screen. So if you haven't already submitted yours yet, please do so now, or use the raise hand icon, and we'll get to as many as we can. We did have a question that did come through. So it says, "Hi, Christian. Are you seeing predatory marketing of marketplace plans? I have seen a few cases of this, and it really affects access if consumers actually eligible for Medicaid. Thank you."
Oh, absolutely. There is, it's just interesting how sometimes there are either organizations out there or individuals that are just targeting our population and our tribal communities, and they go out there thinking that, if I get them on, either I get a commission or, they get paid somehow, and they are targeting them in that way. There's also the scams that happen as well too. And I think that's the reason why a lot of this outreach and education is extremely important for our tribal communities, to make sure that they're aware of some of these things that happen. You don't want someone asking for their password. You don't want someone asking for their income information and things like that as well too. It happens across the board, whether if it's Medicaid, CHIP, Medicare, or even the marketplace as well too.
Thank you. Another question we have is, when you refer to tribal sisters, are you also referring to tribal liaisons supporting many state agencies and organizations as well?
No, when I speak of tribal enrollment assisters, I'm talking about the patient benefit coordinators. I'm talking about they have different titles that that's the umbrella that I'm when I refer to tribal enrollment assisters. Tribal liaisons are completely different from enrollment assisters. Enrollment assisters are the ones um, that see the patients or the tribal citizens, and they go through the whole Medicaid application or Medicare application or the marketplace application. And they make sure that all their documents are in, they make sure that they understand what the coverage is also, how the benefits within the coverage is beneficial for them as well too. So when I talk about tribal enrollment assisters, that's who I'm talking about. You know, this work is so hard at times, talking about some of the most rural areas as well too. We have, sometimes we have one patient benefit coordinator, or maybe we have just one a sister somewhere in a rural tribal community compared to maybe 600 people that they have to make sure that they reach out to and talk to. So it's always interesting to kind of see like, okay, well, what else is going on? How else are you helping your enrollment, not your enrollment, but your tribal citizens as well too? And we want to listen to that and we want to hear that. And a lot of that, what you share with us, also helps us on a national level to advocate on certain things, maybe whether if it's funding or maybe we need more training. And it helps us also to figure out what those topics can be.
Thanks, Christian. In addition to that, has there been an instance where you've tried something that you considered a best practice, or you thought it may work, but you ran across some roadblocks that were surprising to you? We'd be happy to hear that, because anything that you were able to share with us, we're able to take that back and think about it and try to figure out how we can help.
While you guys are thinking or trying to type fast. Oh, there's one that just recently came across my desk, and I'm so glad that this individual was able to share this as well too, was that in current day right now, we still have tribal citizens that are afraid to go to the clinic to get assistance with maybe it's their Medicaid application, and that's the reason why they don't go. Is just because of the feeling of, that's where COVID patients go to as well too. And I don't want to get sick, so they're hesitant to go to the hospital, which is something really interesting when you think about this. And since COVID hit so hard within tribal communities, that as of today, we still have tribal citizens that think of that. So that's the reason why. And then you think, well, maybe that's the reason why we have a lot of uninsured and those that might not have renewed their Medicaid application during this unwinding. So it was just interesting just to kind of hear those kind of stories as well.
It states, I'm glad that partnership in California is sharing those whose Medi-Cal renewals are due. It would have been nice if that information was available to us when the public health emergency ended last year.
Oh, I'm so glad for that. Yeah, some of our states are a little behind in sharing those things, but I think being able to let them know how beneficial it is as well too. You want it to continue, not just because of the Medicaid unwinding that's happening right now, that if it's something that's helping you, it's always good to share that as well too. We have our CMS Native American contacts that are also wanting to hear this kind of information. And for California, Cindy Lamesh, she's pretty awesome. So get to know your Native American contacts and share that information with them as well too. If you're encountering any kind of pushback, or you're trying to maybe explain to your state Medicaid about being able to do data sharing as well too, CMS Division of Tribal Affairs staff, as well as your Native American contacts. Inform them, let them know so they can help you.
Okay, looks like we don't have any other questions, and we're right at the end of our webinar. Also just wanted to remind everyone that remind beneficiaries that now that they are enrolled, for folks who have not lost coverage or making sure they're enrolled, folks have not been probably accessing their coverage as much as they used to due to the unwinding of the pandemic. So make sure folks are using their coverage. So make sure they're going to the doctor, make sure they're get back to using their preventive services, going to their primary care physician. So OMH is the CMS Office of Minority Health has an excellent document on from coverage to care. So make sure you get that information out to folks, and that is on our CMS website as well. You can just search Office of Minority Health, CMS Office of Minority Health. So from coverage to care, once you have coverage, make sure you're using the coverage. So we're getting people covered, but we want to make sure they're taking care of their healthcare benefits. They're using their healthcare benefits. Someone has one other question. I think we may be able to do one other, and then we'll close.
Yes, it says from question from Robin. This may be a silly question. We are in a very rural area. How do you get the list of when renewals are due for PHC and such?
Okay, so it depends on your state. If your state Medicaid has not shared that out, that's something to, I guess the one thing that you should do is talk to your Native American contact. Get a hold of them and see if there's anything like that within your state. That's probably your best contact right now. You can always reach out to me as well, and we can start looking to see if that your state is doing that data sharing of providing the list of individuals that are going to be falling off of Medicaid during this unwinding. But each state is a little different of how they share that information as well too. Is there anything you want to add, Beverly?
No, you covered it. So thank you so much, everyone. Thanks so much for joining. And Christian, you did an amazing job as always. We just love you. Love partnering with you. So I would like to thank everyone for your participation in this webinar. I want to remind you that a copy of the webinar and the slides will likely go on before the copy of the webinar goes on. It takes a while for our contractor to get that available, but we can get the slides up, and that will be found on our American Indian and Alaska Native Outreach and Education websites under All Tribes Calls. And that website again is go.cms.gov/AIAN. We don't have them up yet. I saw someone mention that, but we will get them up as soon as possible. As always, you can submit any inquiries to the CMS Division of Tribal Affairs mailbox at tribalaffairs@cms.hhs.gov. And with that said, I hope you all have a great afternoon. Thank you so much.